Hello, this is Dr. Lewerenz at Longevity Health Institute. Hope this finds you well. Here at the practice here in Rochester Hills, Michigan, doing personalized preventative functional medicine, as you always know, bringing you the best in tomorrow's medicine. I always say today. So listen though, here's the thing, is there's something I call the deadly trio. I kind of coined the deadly trio because of this. Not only do I see it here, but just a new recent published research that came out in the European Journal of Preventive Cardiology, published by Dr. Ludwig, shows that these three significant events are deadly and have high mortality related to cardiovascular disease, cancer, and death. So what are the three? What are the deadly trio? One is high job stress, hypertension, and poor sleep. That's high job stress, hypertension, and poor sleep. Now we could all say that obviously this is very typical, and in this German study that was published in a European Preventive Cardiology, Dr. Ludwig found that it was a highly statistical significance when he followed these 2,000 patients over a 10-year period, that the people that had these three had a very significant increase in cardiovascular events and cancer events. So what's the number one cause of mortality? Death in America. Cardiovascular disease. What's number two? Cancer. And that's not opinion, that's fact. So what can you do? Well, when you hear about this study and something I see here at Longevity Health Institute, and when you take a personalized functional medical approach, what do we have to do? What do we have to do to impress upon you and empower you to fix? And that is poor sleep, recognize the mind-body connection, recognize essentially stress, and in this case job-related stress, and recognize poor sleep, and recognize hypertension. Okay, and these are very related. For instance, you take somebody that's got a lot of autonomic adrenal stress, a lot of mitigating stuff in their body that is creating a lot of anxiety and worry and things with job like deadlines and high work hours and pressure and etc. You're pretty much guaranteed that they're not going to sleep very well. Why? They get this adrenal cortical response, cortisol spike at night, disrupts sleep, creates bad sleep patterns, mitigates actually melatonin in the brain that's released, but also goes down with aging. Depending on their age and what's happening, they start lowering other hormones. Next thing you know, again, they're not sleeping well. Sleep, recovery, regeneration then causes, or lack of, high blood pressure. Often now they're tired, wired and tired we call it. Okay, and so what do? You grab caffeine, they're drinking a lot of coffee, hypertensive responses go up, and vascular systemic resistance, meaning hypertension, vessels become tighter and more constricted and less pliable and elastic. So it's a perfect storm. So you got to pay attention to your stress levels and try to do some lifestyle changes that actually lower stress responses. You have to make sure you're sleeping, and you have to make sure that if you have hypertension, whether it's naturally or lifestyle treated or prescription medication treated, it's necessary. So let's start with this. What are some of the common things at Longevity Health Institute that me and my practitioners used to help you sleep? Well, first you got to treat the problem. So if it's an adrenal stress response and we test in saliva their cortisol levels going up at night, we know that, then we know that we need herbs, we need some natural things, we need some magnesium, we need some maybe CBD or some things that actually calm the brain, amino acids that calm the brain and body, so that they're not just adrenally calming down, but their body physically is calming down and they can get some sleep. Obviously, sleep is regeneration and recovery, and then that begets itself, okay? If blood pressure is high, regardless of why, that has to be treated, even if we're empowering them and directing them in some lifestyle changes. So whether that's exercise, whether that's they're quit smoking, whether that's reducing caffeine, whether that's working on a diet that's high in plant-based fruits and vegetables, off of salt and animal products, And we have a weight loss program here that's very effective and efficient in a medical level, not just to lose fat and weight, but also to get healthier. So these lifestyle things can help lower blood pressure, but also if they need a medication, using the right appropriate medication. And in previous videos, you heard me talk about this advanced test that we actually offer in our office. That's a really high personalized functional medical test for blood pressure that actually checks your central core blood pressure elasticity versus and comparing your brachial pressure, which can be related to stress. Plus, we do an autonomic test that actually checks your peripheral vascular resistance and your autonomic response, meaning stress. And so then we know why you have high blood pressure, then we know the best way to treat it. And if it's treated, are you treated efficiently? So is your blood pressure actually truly core in the aorta, affecting the kidneys, affecting the carotids? Is it reduced? Okay. Then the other thing that when you talk about job stress and just life stress, okay, in this deadly trio of things, is that you have to treat the mind body. So things that we love to use are guided meditation. There's 2 wonderful guided meditation apps we use here a lot. Heart Math is one. These are on smartphones. Or Headspace is another app. Wonderful. And it's not going to feel right, but you actually have to work on it. It's like going to the gym for weight loss or to get into shape. 10 minutes, 15 minutes, once, twice a day, getting in that habit of carving out that time to really relax the mind and calm the body and get these things to interface is very important and essential, so that you calm yourself and you start having a adrenal balance and a sleep balance, and often you'll find blood pressure drops, etc. Okay. Yoga is wonderful too, of course. It does a lot of mind body plus physical. Exercise of any type actually will reduce blood pressure, and it has a stress response and a well-being response, which I think is very important for us to feel well. But just remember, the deadly trio: poor sleep, high job stress, and hypertension, and proven in a study, is a very significant high rate of cardiovascular disease and events and cancer. Okay, these can be mitigated. We can help you do these in this personalized wellness approach that we offer, functional personalized medicine. But take those seriously. Share this with loved ones and others, with spouses and family that you know, because we're Americans, we're type A, we're driven. If we can achieve this, we can achieve this. If we can achieve this, we can achieve this. We need to self-check and look in the mirror a little bit about taking care of self and a little bit of self-love, so that we can last in this marathon of life. It's not a sprint, okay? It's a spiritual journey of actually appreciation and gratitude, but a journey, okay, to get you there well, so that you can really enjoy it. You can thrive, not just survive. Okay, so hopefully that's enlightening. Pay attention to those 3. We can always help you with it here at Longevity Health Institute. Share this with others. Follow me on the web. Follow me on Instagram. Come see us if you need help with anything. And we do phone consults around the country, me and my practitioners. We're here in Rochester, in Madison Heights, and soon to be Bloomfield. So, Dr. Lewerenz, be well.